When we talk about measuring what we use to qualify as being overweight or obese, I guess, when we say, well, 2/3 of our adult population being overweight, that means if you're 1 pound over your ideal body weight. So it does exaggerate significantly that number, but still 1/3 of them are actually in the obese range. How do you qualify, and what's the best way for people to sort of look at themselves and measure, do I really need to do something?
Well, the popular way of doing it nowadays is this term known as the BMI, or the body mass index. Now, that was developed from population studies, epidemiological studies, where they take 200,000 people and they just kind of look at them and say, well, what happens to a group that has a certain index in a certain range? And the index is basically a mathematical ratio between your weight and the square of your height, and you get a number. And so you take 200,000 people and you find out at what number, what ratio, is there a minimal amount of illnesses that seem to be associated with being overweight, like diabetes, heart attacks, gastrointestinal problems, sleep apnea, all those types of things. Where is that number? Where's the number that just does a little bit, and where's the number that starts to accelerate? Well, they did this. So what we have now is we have a BMI that's defined as, quote, normal weight, which is less than 24. And around 24 to 30 is considered overweight. And over 30 to 35 is what we call grade 1 obesity. And 35 to 40 is grade 2 obesity. Over 40, they used to call it morbid obesity. And that was felt to be a cruel term. So we now, over 40, we just call it extreme obesity. So that's the politically correct term now. But if you look at the curve, it's not quite linear. It actually accelerates. So it's a curve, so that as you cross over from 29 to 30, from overweight to grade 1 obesity, the relative risk of that person having cardiovascular events increases. And then as you cross from 35 to 40, it accelerates even further. So the goal of a patient, I tell them, is to try to reduce your weight or your body fat so that you move at least 2 BMI units from wherever you start. And actually, the Institute of Medicine has said that the studies show that wherever you are, if you can either reduce your body weight by 10%, mostly being body fat, or remove two BMI units, just that move downwards improves your health. It reduces risk factors. And that's important because so many people at the beginning of a weight loss effort feel lost, or they feel so overwhelmed. They look at that journey down, and they really need to be focusing a little bit more short term on some immediate goals, like improving my health. And it doesn't take much. So if you have a patient that's weighing, say, 300 pounds, 30-pound weight loss is a huge benefit for them. And even though they remain technically obese, they still have improved their health. So I try to get people to focus on what we can do with the present weight and how can we immediately, in the short term, get a little bit of health improvement. And that's a way that people should look at those numbers.